Hi, we are back with Congressman Pete Sessions. He's the House representative, of course, for the 17th Congressional District of Texas. Congressman, about 45%, we wish 75 in some cases, of Texans are fully vaccinated, according to the CDC. And you're about to head to Mejia tomorrow, where that number is even lower. It's at 34% from what we understand. What would your advice be to Central Texans? We just talked about before the break that you are fully vaccinated. What would your advice be to Central Texans with those numbers?
My advice is simple, and that is that we were learning that COVID-19 was one matter, the Delta variant and those that are coming afterwards is a different matter. It's a different matter. It's easier to catch. It is more deadly. And in fact, more deaths are occurring because of it. If you have had a vaccination, you stand a better chance of not going into the hospital and making it. But our hospitals are full. We need to make sure that people do see the seriousness. And in not doing that, you place yourself and your family at great risk, your loved ones at great risk. And the stories too often have been about a husband that passed away, left a young wife and children. We need to follow whichever guide you want. But my own personal guide and the guide of my family, my son is a medical doctor, and he said to me, "Dad, this is far more dangerous. You need to make sure." I said, "Bill, I've gotten it done." So I hope others just heed the advice.
We unfortunately have heard this week at our station specifically about the need in rural hospitals for ICU beds. What are you and other local lawmakers doing to push those efforts forward to get them help?
Well, in fact, rural beds are hard to come by because you don't have the trained physicians and the medical personnel that are there prepared for that. So it is a push to get people from rural areas into those larger areas, and the areas like Waco and Temple and Austin are full. So that's still very much in line to get your shot.
Okay, let's talk about Afghanistan. Where do you stand on the pullback and how we get Americans and Afghan allies safely out of Afghanistan?
Well, I'm deeply involved in it. Obviously, we've got a number of people who've been at the Bush School down at Texas A&M. They are there. They have lots of people who they've been working with. This is a disaster. The president and this administration have chosen since January 21st to operate with chaos. This is evidently what they like. The border is a problem, the spending is a problem, inflation is a problem. But as it deals with Afghanistan, the problem is that they were working off their own timetable, which said that they expected what happened in 11 days. They expected it to take 18 months. They thought they had time to work through things. And this is a team that is unprepared. It's embarrassing. It's bad for women and children in particular in Afghanistan, and it is a terrible way for America to say that we're friends and we're there to help people. This turns back what certainly is 20 years worth of America versus a Taliban view of the world, and America didn't just turn their back, they ran.
As we approach 9/11, what are you hearing from your constituents and people in the community about this situation?
Well, certainly 9/11 every single year is on our mind, not just because anniversary dates seemingly mean things to people, but really what this means is that we always have to be vigilant. By allowing our borders to be open, we have a record number of known terrorists that are being caught. It's those that we don't catch that we don't know about. And America is not safe. We do not have a president that would insist upon that. And the problem is that it's agreed to by the House of Representatives, Nancy Pelosi, who has given the president all the strength that she can give to make sure he's successful. This is against, I think, the best interest of our country and security-wise.
Congressman Pete Sessions, thank you so much for being with us this evening, and best of luck on your trip to Mejia tomorrow. We'll be right back.